If you are over 60 and living with type 2 diabetes, you have probably heard countless suggestions about what to eat and what to avoid. Among all the advice, one food keeps coming up again and again: olive oil. Some people call it liquid gold. Others say it is the secret behind the Mediterranean lifestyle. But when it comes to type 2 diabetes in seniors, does olive oil really make a measurable difference, or is it just another health trend? As we age, our metabolism naturally slows down. Muscle mass tends to decrease, body fat distribution changes, and insulin sensitivity often declines. This means that after 60, the body does not handle glucose as efficiently as it once did. Blood sugar levels may rise more easily, and managing type 2 diabetes can become more challenging. At the same time, seniors are also at higher risk of cardiovascular disease, high blood pressure, and chronic inflammation. That is why choosing the right fats becomes extremely important. Olive oil, especially extra virgin olive oil, is rich in monounsaturated fats. Unlike saturated fats, which are found in many processed foods and fatty meats, monounsaturated fats are associated with improved heart health. For seniors with type 2 diabetes, this matters a lot because diabetes significantly increases the risk of heart attacks and strokes. Supporting cardiovascular health is not optional. It is essential. One of the key components of olive oil is oleic acid. This monounsaturated fatty acid has been studied for its potential role in improving insulin sensitivity. Insulin sensitivity refers to how effectively the body's cells respond to insulin. When cells respond well, they can absorb glucose from the bloodstream more efficiently, helping to keep blood sugar levels stable. Some research suggests that diets rich in monounsaturated fats, like those found in olive oil, may support better glycemic control compared to diets high in refined carbohydrates or saturated fats. In addition to healthy fats, extra virgin olive oil contains powerful antioxidants known as polyphenols. These compounds help combat oxidative stress. Oxidative stress increases with age and is particularly elevated in people with type 2 diabetes. High blood sugar levels can generate free radicals, which damage cells and blood vessels over time. This damage contributes to complications such as neuropathy, kidney disease, and vision problems. By providing antioxidant protection, olive oil may help reduce some of this cellular stress. Another important factor is inflammation. Chronic low-grade inflammation is common in older adults and is closely linked to insulin resistance. Polyphenols in olive oil have anti-inflammatory properties. By helping to reduce inflammation, olive oil may indirectly support better metabolic balance. For seniors managing diabetes, reducing inflammation is not only about comfort, it is about protecting organs and preserving long-term health. There is also evidence that incorporating olive oil into meals can influence how the body responds to carbohydrates. When healthy fats are consumed alongside carbohydrates, they can slow down the absorption of glucose into the bloodstream. This may help prevent sharp spikes in blood sugar after meals. For example, adding olive oil to vegetables, salads, or even whole grains may contribute to a more gradual rise in blood sugar compared to eating carbohydrates alone. However, it is important to be realistic. Olive oil is not a cure for type 2 diabetes. It does not replace medication, physical activity, or medical supervision. What it can do is become part of a broader dietary pattern that supports metabolic health. The Mediterranean diet, which emphasizes olive oil, vegetables, legumes, fish, nuts, and whole grains, has been widely studied for its benefits in people with type 2 diabetes. Seniors who follow this style of eating often show better blood sugar control and improved lipid profiles compared to those following highly processed Western diets. Weight management is another key issue. Excess body fat, especially around the abdomen, increases insulin resistance. Olive oil is calorie-dense, so portion control is crucial. While it is a healthier fat choice, consuming it in large amounts can still contribute to weight gain. For seniors with limited physical activity, even small caloric excesses can accumulate over time. A moderate approach is best, using olive oil to replace less healthy fats rather than simply adding it on top of an already high-calorie diet. It is also worth discussing cholesterol. Many seniors with type 2 diabetes struggle with abnormal cholesterol levels. Olive oil has been shown to help increase HDL cholesterol, often called good cholesterol, while reducing LDL oxidation. Oxidized LDL is particularly harmful because it contributes to plaque formation in the arteries. By improving the quality of cholesterol particles, olive oil may offer additional cardiovascular protection. Blood pressure is another factor to consider. Hypertension is common in older adults and often coexists with diabetes. Some studies suggest that regular consumption of extra virgin olive oil may have a modest effect in lowering blood pressure. While the effect is not dramatic, even small reductions can make a difference over time in reducing cardiovascular risk. For seniors wondering how to incorporate olive oil into their daily routine, simplicity works best. Drizzling it over steamed vegetables, using it as a base for salad dressings, or lightly sautéing foods at moderate temperatures are practical options. Choosing high-quality extra virgin olive oil ensures a higher concentration of beneficial polyphenols. Storing it properly, away from heat and light, helps preserve its nutritional value. It is equally important to avoid common mistakes. Frying foods at very high temperatures for long periods can degrade some of the beneficial compounds. Relying on olive oil while continuing to consume high amounts of refined sugar, white bread, and processed snacks will not produce meaningful improvements. Olive oil works best as part of a comprehensive strategy that includes balanced meals, regular physical activity such as walking or resistance training, adequate sleep, and stress management. For seniors taking medications such as insulin or oral hypoglycemic agents, any dietary changes should be discussed with a healthcare professional. Improving insulin sensitivity and lowering blood sugar through diet may require adjustments in medication to prevent hypoglycemia. Monitoring blood glucose regularly provides valuable feedback on how the body responds to specific foods and meal patterns. So, does olive oil really make a difference for type 2 diabetes in seniors? The honest answer is yes, but within context. Olive oil alone will not reverse diabetes. Yet, when used to replace unhealthy fats and combined with a nutrient-rich, minimally processed diet, it can contribute to better blood sugar control, improved cardiovascular markers, reduced inflammation, and enhanced overall metabolic health. Aging does not mean losing control over your health. Small, consistent choices add up. Swapping butter or margarine for extra virgin olive oil, choosing whole foods over processed ones, and staying active can collectively create meaningful change. For seniors living with type 2 diabetes, olive oil is not magic, but it is a scientifically supported tool that fits naturally into a heart, healthy, and diabetes-friendly lifestyle. In the end, managing type 2 diabetes after 60 is about building sustainable habits. Olive oil can be one of those habits, simple, accessible, and backed by evidence. When combined with mindful eating and regular medical care, it can play a valuable role in supporting long-term health and vitality.